China has sent expert teams and medical supplies to Guinea, Liberia, and Sierra Leone to assist with the prevention and control of the Ebola virus. In Guinea, the 23rd batch of medical teams have been working around the clock to handle the epidemic. Its head, Kong Qingyu, shares the latest method of treating Ebola and how to prevent the spread of the disease. Lionel Donovan has more.
Guinea is facing a crisis of critical proportions thanks to the Ebola virus. Kong Qingyu, a Chinese medical expert who's stationed in the country, said that countermeasures had been taken by the government, but they've been weak in combating the virus. However, the Guinean government has tightened control of its borders with new protocols, including temperature checks for anyone crossing their borders. So far, no Chinese citizens or workers have been confirmed as having the virus.
The Ebola virus has its own features. It's mainly transmitted by blood and bodily fluids. There is a high risk of getting infected after being in contact with the patients with the disease. However, the virus has rarely gone airborne or being spread through water and food.
Kong says it's important to inform the Guinean people of the nature of the epidemic. He and his team have made efforts to spread the knowledge of Ebola prevention among the locals, with experts also advising people to wash their hands or any other body part immediately after contact with those carrying the virus.
We have also discovered that those who are more likely to contract the disease are people with breaks in the skin that come from new wounds, operation incisions, and ulcers. Once coming into contact with the virus, people have a much higher risk of getting infected.
The virus has claimed nearly 1,000 lives in West Africa, mostly in Guinea, Liberia, and Sierra Leone. The World Health Organization issued a warning stating that the disease is now a public health emergency of international concern. As part of the international response, China has sent more experts to help contain the Ebola virus, who will conduct disinfection and protection training with local doctors and nurses. Lionel Donovan, CCTV.